Your eyes are not just seeing the world, they are revealing the condition of your heart, not poetically, not as a figure of speech. In a way that cardiologists and eye specialists have spent years studying, verifying, and publishing in some of the most respected medical journals in the world, the blood vessels inside your eyes are the only blood vessels in the entire human body that can be seen directly without surgery, without imaging machines, without a single incision. And what those vessels are showing right now in this moment is a reflection of what is happening inside the arteries surrounding your heart. If you have ever had an eye exam and thought it was just about your vision, what you are about to discover is going to permanently change how you think about every eye appointment you have for the rest of your life. Here is what most people never get told. Your eyes and your heart are not separate systems that happen to share a body. They are part of the same continuous vascular network, fed by the same blood, shaped by the same biological environment, and damaged by the same underlying conditions. The tiny blood vessels at the back of your retina and the arteries wrapping around your heart developed from the same embryological tissue. They respond to the same inflammatory signals, the same blood pressure changes, the same metabolic dysfunction, the same cholesterol deposits. Whatever is quietly happening inside your coronary arteries right now is simultaneously happening inside your retinal vessels. The critical difference is that one of those locations is completely invisible without specialized cardiac imaging, and the other one is sitting right there, visible and accessible, every single time someone looks into your eye with the right equipment. Your eyes are not predicting your heart health through coincidence. They are displaying it through shared biology. Most people walk through their entire adult lives treating their eye doctor and their cardiologist as two completely unrelated specialists living in two completely separate worlds. You see the eye doctor when your vision blurs, you see the cardiologist when your chest tightens or your blood pressure climbs to a number that finally scares someone. These feel like different conversations about different problems. But what the research of the last 2 decades has established, with increasing clarity and increasing urgency, is that these conversations are about the same problem happening in the same biological system, and that the eye is offering a window into that system that medicine is only now beginning to use to its full potential. Before we go through the specific ways your eyes are reflecting and predicting cardiovascular risk, there is something I need you to hold on to, because we are coming back to it near the end, and it is the most important practical piece of everything covered today. There is a specific finding that can appear in the retinal blood vessels years before any cardiovascular symptom develops, years before any standard cardiac test would catch anything concerning, years before the word crisis enters any medical conversation. It is sitting there in the back of the eye, visible with equipment that already exists in most eye clinics, and most people who have it have never been told what it means for their heart. We will get to exactly what that finding is and what it looks like. But first, the foundation, because the specific findings only carry their full weight once you understand the biology connecting your eyes to your heart. The first way your eyes reflect cardiovascular health is through a condition called hypertensive retinopathy. And what makes this so significant is what it reveals that a standard blood pressure reading cannot. When blood pressure is chronically elevated over months and years, the arteries throughout the body respond by thickening and narrowing, attempting to manage the sustained pressure load on their walls. In the retinal vessels, this process is directly and precisely visible during an eye examination. A trained examiner can see the arterial walls becoming more opaque, the arteries narrowing relative to the veins running alongside them, and in more advanced stages, small hemorrhages and deposits forming in the retinal tissue where the damaged vessel walls have begun to leak. These are not just eye findings. They are a real-time visual display of what is simultaneously happening in the arteries supplying your heart muscle, your kidneys, and your brain. Large studies tracking thousands of people over years have shown that the presence of hypertensive retinal changes predicts cardiovascular events including heart attack and stroke with significant statistical power, independently of any single blood pressure measurement taken at a clinic visit. A single reading captures one moment. The retinal vessels are capturing the accumulated story of everything your blood pressure has been doing to your vascular system over time. That is a fundamentally different and more complete kind of information. The second finding is called arteriovenous nicking, and outside of ophthalmology, almost nobody has heard of it. Yet its cardiovascular implications are ones that every adult should understand. Arteriovenous nicking occurs when a retinal artery, whose wall has become thickened and stiffened by sustained pressure and vascular disease, crosses over a retinal vein and compresses it at the crossing point. The vein appears narrowed or kinked where the artery crosses it, and this subtle change, visible during examination, is a direct representation of arterial wall stiffness. Arterial stiffness is now understood to be one of the most powerful independent predictors of cardiovascular risk that medicine has identified. When arteries lose their natural elasticity and become rigid, the mechanical stress on the heart increases with every single heartbeat. Blood pressure becomes harder to control. The risk of arterial plaque rupture increases, and the probability of a major cardiovascular event rises in a way that standard risk calculators frequently underestimate. When arteriovenous nicking is found in the retina, it is telling an examiner that arterial stiffness is present systemically, not just locally in the eye, and that the cardiovascular system needs attention that goes well beyond what an eye prescription can address. The third connection involves something that has emerged from artificial intelligence research on retinal imaging and that genuinely challenged the assumptions of researchers when the data first appeared. Teams of scientists trained artificial intelligence algorithms to analyze retinal photographs alongside long-term cardiovascular outcome data from large patient populations. What those algorithms discovered is that the subtle patterns in retinal vessel architecture, patterns too fine and too complex for the human eye to consciously identify and quantify, contain enough information about a person's cardiovascular status to predict with statistically significant accuracy whether that person will experience a heart attack or stroke in the coming years. The artificial intelligence was finding cardiovascular signal in a photograph of the eye that no human examiner could have extracted through observation alone. This research is published, it is peer-reviewed, and it is being taken seriously by cardiologists, not just ophthalmologists, because what it points toward is the possibility of cardiovascular risk assessment through a simple, non-invasive, inexpensive retinal photograph at a routine eye examination. The implications for early intervention and prevention are significant enough that multiple major research institutions are now investing heavily in developing this technology for clinical use. The fourth ocular reflection of heart health involves diabetic retinopathy, and the insight here extends beyond the well-known connection between diabetes and cardiovascular disease to something more specific and more actionable. Among people with diabetes, those who show signs of retinal damage from the disease have consistently higher cardiovascular risk than those whose retinas remain unaffected, even when blood sugar control and other risk factors are similar between the groups. The retinal changes are not just a consequence of diabetes. They are an indicator of the extent to which microvascular damage is occurring throughout the body, including in the small vessels of the heart muscle itself. The severity of what is visible in the retina is providing information about the depth and breadth of vascular injury that blood glucose measurements alone cannot fully capture. It is a more complete picture of what the disease is doing to the circulatory system written in the tissue of the eye. And now the finding I told you to hold on to, the specific change in retinal blood vessels that can appear years before a cardiovascular event and carries some of the strongest predictive power of anything detectable during an eye examination. It is called focal arteriolar narrowing. It refers to localized segments of retinal arteries that are narrower than the rest of the vessel, creating an irregular, uneven caliber along the artery's course. These focal narrowings are not random. They correspond to locations where the arterial wall has undergone changes consistent with early atherosclerosis, the accumulation of inflammatory cells, lipid deposits, and fibrous tissue within the vessel wall that is the underlying process behind the vast majority of heart attacks. Finding focal arteriolar narrowing in the retina means finding evidence that the atherosclerotic process is already systemically active, already altering blood vessel walls throughout the body, already on a trajectory toward cardiovascular events that may be years away but are biologically already in motion. The eye examination that most people schedule because their vision feels slightly off is potentially capable of detecting the early stages of the process that leads to heart attack, years before symptoms, years before a stress test would show anything, years before any conversation about cardiac intervention would normally begin. That is not a minor clinical footnote. That is one of the most significant opportunities for early intervention in all of preventive cardiovascular medicine. The fifth and most empowering connection is this. The factors that damage your retinal vessels and the factors that damage your coronary arteries are precisely the same. chronic high blood pressure, elevated blood sugar, smoking, systemic inflammation, high LDL cholesterol, physical inactivity, chronic sleep deprivation, and poor diet are simultaneously driving retinal vascular disease and coronary artery disease through identical biological mechanisms in the same shared vascular environment. This means there is no separate eye health strategy and separate heart health strategy. There is one strategy. Every meal that reduces vascular inflammation is protecting your retinal vessels and your coronary arteries at the same time. Every night of quality sleep is benefiting the blood vessels in your eyes and in your heart simultaneously. Every step of physical activity, every reduction in processed sugar, every addition of the foods that science has shown to support vascular health is working for both systems at once because both systems are one system. Understanding this does not just simplify the conversation, it makes every healthy choice feel twice as meaningful because it is. Your eyes have been carrying detailed, accurate, clinically significant information about the health of your cardiovascular system your entire adult life. That information is there at every eye examination. The question is whether it is being read correctly, communicated clearly, and acted upon before the window for prevention has closed. So here's the question I want you to answer honestly in the comments right now. When was the last time you had a full eye examination where someone looked carefully at the blood vessels at the back of your eye? And did anyone ever explain to you what those vessels might be saying about your heart? Tell me below, because your answer might be the thing that sends someone else in this community to make an appointment that changes the entire direction of their health.